Welcome to Europe. Welcome to One World. My name is Catalyzing, and with my co-chair, Andreas Ulrich, we really welcome you to an outstanding panel. Thank you personally for your engagement. And we want to talk about beating cancer globally. And it's the code maybe, and I'm sure that will be the code, to bring private sector, civil society, UN, and academics together to learn from lessons from the past and to create new solutions. That will be the code, because, you know, it's amazing evolution in medical treatment, but a high discrepancy according the access to innovation and to medicine. So how to overcome these challenges nationwide, but even globally? That's, I think, the philosophy of the World Health Summit. I'm Jalid, the son of Moroccans, came in the 16 from Morocco, from Tangier to Berlin. I'm a gynecologist, and I'm the director of the Department of Gynecology at the Charité. And with Andreas Ulrich, we try to bring the lessons and the different fields together to change the perspective in the world. Andreas, thank you personally for your engagement and bring your experience into this field.
Thank you very much, fantastic moment. That we come together to think about cancer, and we were coming to the room and the start of Europe, but cancer is global, and we need to have global solution. For that reason, panel is not European, it's global. And for that reason, I would like to introduce
So again, thank you very much, Her Excellency from Namibia originally, and Monica Giengos. Thank you very much for your engagement and with your experience. And I think everybody know, but I was really impressed. You rated as one of the Africa's top 100 economic leaders. Amazing. And as the First Lady of Namibia, she has initiated numerous programs that focus on sustainability, lifting vulnerable populations out of poverty tops. Her current focus is the establishment of Center of Excellence to provide a continuum of holistic services to adolescents, including life skills programs, mental health support, and sexual and reproductive health service. So thank you very much for your coming. And thank you on the screen. We welcome you personally, the European Union Commissioner for Health and Food Safety, Stella Kyriakides. I think originally from Malta.
From Cyprus.
Yes, and I'm really, Cyprus. I'm sorry, I apologize. I was asking because the name was much more for Cyprus than for Malta. But nevertheless, thank you very much. And you have made a tremendous work regarding the COVID-19 pandemic challenges. And I know you have done so much work, and I'm really impressed by the programs. But furthermore, with the European Health Union, you are so focusing on the Europe Beating Cancer Plan, and you are really an active and tremendous working advocate on patients, particularly cancer patients' rights. And you was the president of the European Breast Cancer Coalition, Europa Donor. So thank you very much. And it's really pity that you're not personally here, but we are really thankful for your contribution. And I like to welcome also Professor Veronika von Messling, Director General of the Life Science Division of the German Federal Ministry of Education and Research. Thank you for your outstanding engagement even for the German academics and the field. You are a veterinary. And beside this, Berlin has the most attractive zoo in the world. So don't miss it if it's possible. And you have a doctorate degree on this field, and you was the assistant professor of the INRS Institute Armand Frappier in Laval, Quebec in Canada. And then, as you said, professor at Duke and US Medical School in Singapore, and she was the director of the veterinary division at the Paul Ehrlich Institute, which is the German Federal Institute of Vaccines and Biomedicine. So thank you very much for your contribution.
On April 1st, 2015, I was diagnosed with ductus carcinoma in situ, also known as DCIS, the earliest form of breast cancer. When I met my oncologist surgeon, the first thing she did was embrace me and tell me that I'm gonna be okay. I'm okay because of awareness. I was aware and encouraged to start screening for breast cancer once I turned 40. Because of that, my cancer was caught very early. I'm okay because of the support that I received. Healthcare professionals who supported my decision to have a double mastectomy, even though my breast cancer was early. I was encouraged to join a support group of women who had survived and who were undergoing breast cancer. They encouraged me and they inspired me to endure the 11-hour surgery. I was supported with good health insurance. I'm also okay because of advocacy. Right at the moment of diagnosis, I was referred to a patient navigator who helped me to get through the complex healthcare system. She connected me to community resources that gave me food when I was unable to work. When I moved to Ghana in 2016, I wanted to understand what the journey for breast cancer patients in Ghana was like. Unfortunately, The very things that work for me is what contributes to breast cancer being the #1 cause of cancer death in Ghana. Most women, once diagnosed, lack the support that I received. They have family members who are ignorant about breast cancer. There's a stigma still attached to breast cancer. The only thing they hear about breast cancer is when women are dying. They don't get to see women who look like them, so they don't have the encouragement. The financial burden on most women is huge. I ran into a lady once who was being prepped for surgery, a surgery that was going to cost $500. This is a lady who makes $3 a day to feed herself and her children. My one surgery alone was $100,000. Luckily, I was able to raise that $500 to ensure that this woman received the mastectomy so she could be alive to take care of her children. They don't have access to a patient navigator like I did to help them navigate through the very cumbersome, complex healthcare system in Ghana. Even if there are groups out there who can help them pay for the treatments, they have no idea where these groups are or how to find these groups. Just as my doctor embraced me and told me that I was going to be okay, I founded Embrace Society to do the same for every woman in Ghana. We want to create awareness about breast cancer, help to dispel the myth, the fear, make women know that not everybody who's diagnosed is destined to die, and that through early detection, they can survive. I want to support women who've been diagnosed. I once met a lady by chance. This is a woman who made less than $3 a day. She had 2 kids to feed. She was being prepared for surgery that was going to cost $500. Where was she going to get that money from? My one surgery alone cost $100,000. Luckily, I was able to come up with the $500 needed for her to get her mastectomy and continue with her treatment. We want to partner with all the major players in the game, the healthcare providers, the NGOs, the patients, the survivors, the policymakers, to push and advocate for policies that encourage screening, because we do know for a fact that early detection saves lives. To push for policies that help women to pay for their health, to pay for their treatment, so they don't run away to traditional, unorthodox, unproven methods that can contribute to the high death rates. Because ultimately, we all want to have Ghana be a success story when it comes to the fight against breast cancer.
Thank you very much for this very touched message. And as a gynecologist, and as a co-chair of Engage, I think it's very important to underline that really woman health is the key factor to access to every healthcare system. And that's the reason why I like to invite you, Stellar, and thank you again for your engagement so far. And please, your floor, why this is so important. Thank you very much.
Thank you so much, ladies and gentlemen. Thank you so much for the invitation and the opportunity to be here with you and share some thoughts and actions of where we are today with Europe's Beating Cancer Plan. As has been mentioned, we are now almost in the 3rd year of a very difficult pandemic, which has really led us to re-examine the way that we approach all healthcare. And it has also shown us that we can overcome challenges through solidarity. And this is certainly true for cancer prevention, for cancer treatment, and for cancer care. So for us and for myself, promoting global knowledge and exchange and partnership is crucial in working towards cancer control. Just to highlight some numbers, in Europe, around 2.7 million people are diagnosed with cancer every year. And this number is set to grow. And the number, unfortunately, of lives that we lose to cancer is also growing and is predicted to increase by 25% by 2035. So cancer is really the leading cause of death worldwide, leading to 10 million deaths in 2020. When I say these numbers, for myself, they are not just statistics. Each number is a personal story, as the one that we have just heard. And each number represents a family, friends, a patient. And I am able to say this because I am myself having been diagnosed with cancer 3 times. So I am determined on the need that we need to take urgent and collective action to reverse the trends. In Europe, in the EU, we have responded to this challenge through Europe's Beating Cancer Plan. It is our ambitious and comprehensive commitment to cancer prevention and treatment. It is the first time that Europe has a plan that is all-inclusive and with a budget of over 4 billion euro. It represents a modern way of European, I would say, policy making, and it is based in a holistic, health in all policies approach and a multi-stakeholder approach. And crucially, it pursues cooperation beyond the European Union with all international partners so that we can deliver better outcomes for everyone worldwide. For healthy societies, we need sustainable and healthy and accessible health systems. And we are supporting member states' efforts to build exactly that. Since the adoption of the cancer plan, which was 18 months ago, in the midst, or rather at the beginning of the pandemic, we have made considerable progress in each priority area, including research and innovation. And in the short time I have, I want to share some of the actions with you. We have put in place a knowledge center on cancer so that we can coordinate EU research and innovation. We have been instrumental in our new guidelines on cancer screening. Our new approach is based on scientific evidence and on the latest developments. Just to give you an idea, this is the first update of cancer screening and an excellent example, of course, of cooperation with the member states after 20 years. And these are new guidelines, which are not only a major achievement for the EU, because they can be an inspiration for other parts of the world. Tackling inequalities is a crucial part of our cancer plan. It is a vital part of any health strategy. We need to fight inequity. We need to ensure that no one is left behind, and we need to build healthier and more sustainable societies. In the EU, it means that everyone should have the same access to cancer prevention, to cancer screening, treatment, and care, no matter where they live. We are creating a new cancer inequalities registry, where we want to put in place a systematic surveillance and reporting to track the situation in each member state so we can prioritize investments at EU and national level. Cancer research and innovation is also a central part of Horizon Europe mission on cancer, so we can translate the research projects into concrete actions that reach the patient. Ladies and gentlemen, dear friends, with Europe's Beating Cancer Plan, we aim to bring concrete solutions and long-lasting change for cancer patients and their families. But we cannot overcome cancer alone. And that is true for patients, for countries, for the world at large. We need partnerships at every level. This last week, and this is why I was not able to be there personally today, and I feel very sorry about that, I was in Washington to achieve and advance the discussions with the US health leadership. I met with the heads of the National Cancer Institute. I discussed concretely on how we can move together with US Secretary Becerra of Health Becerra, in partnership, the US Cancer Moonshot and Europe's Beating Cancer Plan, the two most ambitious plans against cancer, because I believe that a close transatlantic cooperation can benefit not only patients in the US and the EU, but the cancer community worldwide. And now with the executive order signed by President Biden on data transfers, we have a world of possibilities to exchange more closely. So I will end by saying just two words. Policymakers, medical professionals, all stakeholders, patients, advocates around the world have vital experience and expertise and expertise and perspectives. And I urge us all to take this opportunity to come together, everyone to join in to improve cancer prevention and care. And Europe's Beating Cancer Plan is our roadmap to connect these dots. It is available online. There is an implementation roadmap available so that you can follow the joint actions. And we all together can really turn the tide on cancer, not only in Europe, but globally. It takes a team, a multidisciplinary team, to tackle any cancer patient and to work with any cancer patient. And it takes a team, a global team, to be able to make a difference. So thank you, and I wish you every success in today's deliberations.
Thank you very much, Commissioner Kyriakidis. I think this was a very impressive insight on not only an European plan, but a global plan. And I will take your quote your one of your speech. We are a global team, and we are a global team on stage now. And thank you very much for your contribution. And I would like now hand over to Her Excellency Monica Gingos, First Lady of Namibia, part of the global community of cancer fighters. Over to you.
Thank you. I'm here because I'm the president of the Organization of African First Ladies for Development. And I was recently elected as the president, I think in July. And one of the first mistakes I made was to go home and tell my husband that, oh, there's now two presidents in the house. He didn't think that was very funny, but that doesn't take away from the very serious work that the Organization of African First Ladies does. Because what it does well is it understands the social capital that African First Ladies brings to the table and harnesses that social capital both individually and collectively and speaks in one very strong voice and convenes very powerful organized events like I think Andreas mentioned to me that in 2014 he was in Windhoek, which is the capital city of Namibia, for an African First Ladies Cancer Summit that congregated ministers of health from across the continent, policymakers, researchers, the speakers of most of the parliaments on the continent, and came up with the Africa Declaration, which also enabled African First Ladies to work very closely with their ministers of health. And this did impact policymaking. And part of our focus, and we saw Isabella's story, is really speaking to issues around prevention. And I think of my own grandmother, who I'm named after, who looked after me for some time while I was small. And this is the story of most Africans. Many of us have been looked after by our grandmothers, myself included. Now, to me, as a First Lady who's unelected, who's not a policymaker, but who has social capital that can influence people, I think of the African matriarch, like our grandmothers, who are powerful advocates in our communities, who get left behind when we talk about partnerships. I think of traditional leaders. In Namibia, our traditional leaders played a fundamental role in dispelling COVID myths. So being unelected as we are, but having a voice in public, we also recognize those who are unelected but have critical voices in public, and we harness those voices. But to get back to my grandmother and why it's important to encourage prevention, to encourage early detection, is she for a long time struggled with a sore throat. And a couple of weeks before she passed away, we were told that it was throat cancer. Now imagine, you have an 83% survival rate in throat cancer, and this is what took her. And it was devastating for us. And any preventable death is devastating. And that's why we use our advocacy power to prevent these devastating preventable deaths, which we see reducing disease burdens in other parts of the world, but they're increasing on the continent. and why it's important for us to reduce it. It's devastating personally, and it's devastating for us as a continent. And I think it was correctly said, we are in this together. Every single life matters. And this is what the Organization of African First Ladies tries to do collectively. And when we speak about why prevention is necessary, early detection is necessary, treatment, equal treatment for all is necessary. When I go to the doctor and he asks me, what's your family history on X or Y? I often can't tell them, because often we were just told, no, your uncle was bewitched. Meanwhile, he had a heart problem, or he had died from cancer. So some of our belief systems actually prevent us from understanding our health outcome. So the need for data. So the integration of African First Ladies with our domestic health systems and policies is critical. But I'd like to use an example of how this translated into national cancer care. We had a former First Lady of Ethiopia, Her Excellency Roman Tesfaye, who was the chairperson of a national council. She chaired this council, which included every single government agency responsible for cancer prevention, NGOs, developmental organizations, and she did an incredibly good job of that. Currently, we have an incumbent First Lady, Her Excellency Sylvia Odingba from Gabon, who also started a very comprehensive and integrated plan for cancer. And as a result of that, that got integrated into the national care policies and led to the Libreville Cancer Institute. And before the Libreville Cancer Institute, she had a program that she ran that became responsible for 30% of all cancer detection cases in Gabon. And that's significant, it's consequential. And it does show the role that unelected leaders, like First Ladies, like matriarchs in our societies, like traditional leaders, can play in impacting national cancer prevention policies.
Thank you very much.
Every second human will suffer from cancer in 2050 and maybe earlier. So it's really a global challenge. So Professor Veronica von Messling, so can give us please some insights from the program Decades Against Cancer and how we can learn from this?
Oh, it's my pleasure. I mean, cancer is a formidable foe. And I think no matter where you are, as life expectancy increases, which is a wonderful thing in and of itself, our individual risk of experiencing a cancer diagnosis during our lifetime increases as well. And I just read on CNN yesterday, which really scared me, that a pandemic of cancer in people under 50 is looming. So there's multiple factors that come together that really make cancer into this formidable foe. And so beating cancer is an ambitious goal, but rightly so, because we are all affected. And Germany is really fortunate because we do have a very strong and rich cancer research ecosystem. We have the German Center of Cancer Research in Heidelberg, DKFZ, that is really one of the world-renowned powerhouses in basic cancer research. We have a number of networks that really try to support translation of these findings into applications. And then we have centers of excellence in cancer care at many of the German university hospitals, and some of you may actually be part of those. And so there's lots of incentive and funding to all across the value chain. But nonetheless, I think I can only echo what the others have said. To make inroads against cancer, we need to come together. It has to go beyond the traditional thinking of value chain. It has to bring together the different stakeholders, to use one of these other buzzwords, right? The funders, the researchers, the developers, the therapists, but for the patients, but more importantly, with the patients. The patients have to be at the center of this. And this is the thought behind this initiative, Decade Against Cancer, realizing that funding is absolutely important. This is what our ministry does, funding research, but it takes more to really make a dent here. And I just want to name some pain points, I think, that will resonate with everyone, and they are by no means inclusive. So it takes too long from a promising discovery to something that impacts patients' outcome. We still struggle to figure out which therapy will be most beneficial for an individual patient. And very often still, we overlook the patient's actual need across the cancer treatment journey. And all of this requires that funders come together, public and private, that academia and industry comes together, and that we all listen to the patients and include them as we go along to figure out what is it that we can do. So this is where the Decade Against Cancer comes in. We are trying to tear down these barriers, or to at least shake them up a little bit. And we have had, so there's a buy-in of a number of these stakeholders. The initiative aim at addressing the points that I just mentioned, bring the research to the patients, bring the top-notch research and the top-notch treatment approaches to the patients, to improve our diagnostic abilities, to really identify which treatment is most beneficial. Many of these treatments have severe side effects. They're totally worth it. But if we know beforehand for whom it is worth it, that makes all the difference. And then again, listening to the patients and empowering them to play an active role rather than a subject to whom something happens, to really play an active role in this whole treatment process. And so this is what the decade aims to achieve, and trying to really improve patient care, no matter where the patients are. This is on a first level, a German thinking. So if you live in the countryside or in a big city close to a university hospital, it should not make a difference. It should also not make a difference what type of cancer you have. But of course, the thinking bigger is already ingrained in this approach. So we are hoping to make a contribution to our patients, but also to the patients worldwide. Thank you.
Thank you. Thank you very much. Nino Betzuli, WHO Euro is 50 countries. You're overlooking 53. Sorry. You just had the regional committee meeting. What is new in the planning of WHO conceptual framework in the context of non-communicable diseases, in competitive competitive health problems in the region? What is new? Over to you, please.
Thank you so much. And it's really an honor for me to be here and have an exchange with distinguished panelists, how we can do better to improve the outcomes for the cancer patients, so that their survival does not really depend on the geography or the ability to pay. Mm-hmm. And we know that some of the issues that we have raised by the survivor from Ghana are very relevant also for the WHO European region that comprises of the 53 member states, from the low, middle, the high income countries, and the challenges are the same. So inequality is a key word here in the WHO European region as well, and the limited access, inequalities in access to the rapid diagnosis and the treatment. We recently published the European first of its kind, the childhood cancer inequality report, first of its kind really globally, that actually showed the shocking results. The childhood mortality from cancer ranges from 9% to 53%. Mm-hmm. So this is really shocking how much the inequality is persistent in the European region. So we talk also about the awareness, the cancer awareness, which is absolutely critical, absolutely important. But we really need to move beyond the awareness and try to solve the persistent challenges that we are facing in our region and globally as well, which is the access to the primary care, which is the capacity of the primary health care system to be able to detect the cancer early, access to the rapid diagnosis, including the pathology services, the coordinated and the rapid referral mechanism, and the access to the quality treatment. These are the critical issues that in the heart of the problems. And having access, universal access to all the services across the continuum of care is absolutely paramount importance. But let me step back here and just say a few words about the prevention, because as a health community in the health sector, we're not only addressing we're not only diagnosing and treating the patients, we also need to ask ourselves how we're doing in terms of the preventing the risk factors. And here I would really like to share with you, some of the data from the European region. In May, we published a report on the obesity in the WHO European region, first European obesity report that actually revealed also the shocking news that the 50% of the European adults are either overweight or obese, and the children, 1 in 3 children of 11 years old have the overweight or the obesity. And we know that the obesity is linked to the 13 different types of the cancer. If we take the alcohol, also, which is, the responsible for the 7 types of the cancer, that's and the European region is having the highest alcohol consumption per capita in the world. So these are some of the data that we really need to look into it. And when you asked me the question about the what is new from the regional committee, which we just had in September in Tel Aviv in Israel. So number of critical action points and the roadmaps that were adopted by all 53 member states at the regional committee. And one is the cervical roadmap for cervical cancer elimination for the European region, which outlines the regional specificity for the European region, how we can tackle the needs in enhancing the data, in enhancing the surveillance and the monitoring, increase the uptake of HPV vaccination, which we are still struggling in the European region. Only 30 member states in the European region have the HPV vaccine included in their national immunization program. So we really need to work hard to increase uptake, and as well as the treatment and the follow-up action. So it is a really momentous opportunity for all of us, because we have the technical know-how, we have the political will to, for the first time, eliminate the cancer, and we really need to make this our legacy. We have. This is really the opportunity for our generation to make it reality. So the framework for action on alcohol was also adopted at the regional committee, which sets the path towards the best buys, implementation of the best buys in the alcohol control policies. And I'm very happy that we are working hand in hand with the European Commission, with the DG Santé, on building the evidence together, so that through the implementation research in the country, so that we know what are some of the best alcohol policy control measures to implement in the European region. That will be also the learning that can be applicable and can be used worldwide.
Thank you very much.
First of all, I want to thank you, Nino, for this holistic approach. And you are gynecologist. I'm really proud that you preserve your holistic awareness. And that's, I think, is even the key point. I want to thank you, Bernd Onsorge, for your support of even our GIZ, Charité, Mali, Morocco project, what include even other now more than 25 countries in the tumor conferences to discuss complex cases. And we know human resources, everything. But how can new technology help us to become better, to overcome these challenges? We just listened to our panelists.
No, thank you, Shalit, and thanks for having me as a representative of the private sector, looking particularly after technologies. And of course, I mean, hearing the other speakers, the best thing is to find prevention that cancer never occurs. But that is a vision for the long term. And in the meantime, I mean, we do face situations like, I think the prognosis right now is that there's in 2040 about 50% more new cancers as compared to today. So we have to meet that challenge, and technology can have a great contribution to it. And I would look at it in 2 or even 3 ways. One, really to contribute to early diagnosis of cancer. Their advanced methodologies are in place. The European Beat Cancer Plan, as well as the Dekade gegen Krebs, is looking at these technologies in particular. And there is high sensitive, very low burden diagnostic tools that are not cheap to do, complementing very basic screening mechanism as well, but they are worth the investment in order to really detect cancer as early as by any means possible to cure it. The second piece, therapy can become much more precise if you combine all data available for a patient and mirror it to similar patient journeys. You can develop what we call now in technology digital twins, AI-based technologies that help the physician assist by combining knowledge from other cases. What's the best possible personalized and most precise and successful therapy, aiming that this particular cancer can be turned into a chronic disease rather than a life-threatening disease. And last but not least, the example you mentioned, how can we translate technologies and knowledge in assisting from the developed economies, the low and middle income countries, and their digital tools that are without frontiers. You can assist over thousands of kilometers with knowledge and with digital engagement tools, know-how in the low and middle income countries to bring know-how together to also serve patients in the low and middle income countries on the most advanced levels that we have developed in the world. The final comment I'd like to make on this token, I mean, it was, as we all see, still we're basically now living with a COVID pandemic. And it was really amazing to see and really concerning to see that healthcare systems across the world were not resilient enough to deal with this pandemic, and at the same time to deal with chronic diseases, because cancer, heart attacks, and strokes are not impressed by a virus. Well, obviously we had to be. And so to also think through how can we develop resilient healthcare systems that can make also early primary and secondary prevention, keep it even under stress of a healthcare system, a priority. And that's also something when we look at holistic development of healthcare systems that should enjoy priority.
Thank you.
Thank you very much. Eiko, thoughts? What is the role of the civil society? What can you move? And what is new in your network of cancer survivor in Europe? Or what can be translated globally?
Thank you for the invitation. Let me have a question first. I had cervical cancer when I was 30 years old. It was right after my second child was born. I had radical hysterectomy, I had chemotherapy, and I have radiotherapy because of the metastasis. I am really lucky. I am really lucky that I am alive. And the question, do I deserve it? No, not at all, because it is not about deserving something. Life is not about deserving it. The science is developing so fast, and I think we are just running behind. We know that there are several big opportunities to save lives or prolong lives in good quality. But from the other side, accessibility is not the same everywhere in the world. And I think we all, you there and we here, want to change on this. We are from a European society, ESGO, which is the European Society of Gynecological Oncology, and it has a network for patient advocacy groups. 28 countries, 70 patient advocacy groups from Europe. So ESGO doctors and engage patients and patient advocacy groups have a really big collaboration. We work together on European level. So that means we learn a lot from the doctors, and the doctors learn a lot from us, right? We have common projects, for example, in the field of HPV prevention. We have campaigns together Europe-wide, and I can say worldwide as well, because we established the Gynecological Oncology Day, 20th of September. We have clinical trial project. And also we have quality of life series. This year is sexual health and also menopause. We do it together. And also we are creating brochures, and brochures are translated several languages and used on local level. And that's really great. So what we do is we are empowering the patient. We include the patient voice into all our work. And what is really important that we work on European level, high level, I can say, and then we bring this knowledge on national level. So from one side, geography is not important, but from the other side, geography is important. Because it is really great that, for example, we have Hungarian doctors in ESGO, and we work together, and then we go back home, and we use that work on that level. Because what we do, at the end of the day, the needs are on local level. So this is why collaboration is really important. Thank you.
Eiko, allow me, it's not really nice to have. We really learn from patients. And we have even, I think, a wonderful program to educate ourselves together. And it's really not something easy, but it's a must. And thank you very much that you even take your responsibility now for all the women. Thank you very much.
And only one comment, and you just not learn from us, but you listen. Listen to us. And I think this is a key word. So thank you so much.
Thank you. Her Excellency, Monika Gingos. So thank you again for your engagement, very clear words, but how to overcome this gap, knowledge, translating into practice, and how we can overcome the barriers in developing partnerships, sustainable long-term partnerships.
I think Ika really answered that question when she said listening. I think it's at the core, but we can't listen to each other if we don't see each other the same. I think a lot of problems in the world can be solved when there's a basic recognition of the humanity of the person in front of you. And some of those barriers, we know what they are. How we look at people in the developing world. Within the developing world, how we look at one another. So really the respect of humanity. So at an individual and national level, there shouldn't be issues of ethnicity. There shouldn't be inequalities relating to individual outcome, because we talk about inequality, both from the perspective of continent to continent, between countries, but also within countries. And I say this with a lot of concern, because Namibia is the second most unequal country in the world, second only to South Africa. And a lot of our inequality is structural. But like many, so in African countries, inequalities are normally on the fault lines of ethnicity or race. Race being countries like Namibia, South Africa, Zimbabwe, who have settler colonies of white people. So if I get cancer in Namibia, I have nothing to worry about, because there's a segment of the Namibian population that has access to the best treatment facilities, the best technology. I can be treated fully in the country. Whereas the same people, the majority of the people in the same country don't have access to that because it's too expensive. Then we have the inequalities where we want to see between countries, because in other countries, they don't have what Namibia has. You see our political leadership taking up beds in European cancer hospitals, which really should be beds they take up in their own countries, because in order for you to show trust and faith and reap the produce of your political work, you must be hospitalized at home. But more than being hospitalized at home, that level of care must be accessible as widely as possible. So as a First Lady, I often rely on the serenity prayer. God, give me the ability to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And when it comes to issues of public health, what we saw happening during COVID, the COVID response and the inequities that really showed themselves quite starkly there, is there's things we cannot change. But there's things we need courage to change. And the issues of international collaboration, looking at each other as human beings, those are things we can change, but we need the courage to have honest conversations about how do we establish true partnerships, true collaboration. How do we listen to each other? Because I can't listen to somebody who I have a cultural problem with, or an ethnicity problem with, or a racial problem with. So the core to me is really listening and seeing each other as a world whose outcomes are interrelated, regardless of which continent you're on. So Europe doing well on cancer care and prevention, but the rest of the world is doing very badly, is not good for Europe. Everybody doing relatively well on this is good for everybody, including Europe. So true partnerships where we listen to one another, see each other's humanity is at the core of real partnership.
Thank you.
Thank you very much. Professor von Messling, the courage to change. What do you think about? How can you translate the Dekade gegen Krebs into a commitment to change?
I think what really resonates with me is let's look at the things that we can do and be aware of what we cannot do, but not be discouraged by that. And so we have within Germany a lot of challenges to address, and the Decade Against Cancer is trying to do this in a holistic approach, because as I just said before, we also have increasing collaborations within Europe that's very structured. We've heard about this, but also beyond Europe on the institutional level. So for example, the DKFZ has a collaboration with Namibia, and they do these online virtual tumor conferences. We also have increasing recognition that strengthening the research communities in the different countries is the foundation for what you were asking, or what you were rightly saying. If we want people to be able to have care close to home, then the quality of care has to be there. And that means we need people trained and available to actually provide that type of care. They need the equipment and the ability, very much like we were saying, what we need in Europe as well. The primary care system has to be equipped and able to recognize, oh, this is something where maybe somebody has to go to see a specialist, and this is something that we can do right here. And the transfer back and forth has to work. Honestly, that's exactly the issues that we are addressing in the Decade Against Cancer, also in Germany. It's a different level. I'm not saying that, but it's the same problem. It's like my dad having cancer and saying, oh, I'm not going to the university hospital because I won't find parking. And I was like, what? Like, this is actually a barrier to care. And I know this is a bit ridiculous, but I think listening to people, finding out what are these barriers, how can we make sure people can get the care they need, what we learn in Germany is transferable on certain levels. Another point that I would like to make is the pandemic was a unique experience for all of us, and I think mostly negative, but there's a few positive ones, and that is this digitalization, this tumor conferences, this ease that we all now have with digital communications, with video conferencing, with all these levels of exchange. That actually is also a huge opportunity, not just for infectious diseases, but for all types of patient care, and also for research, because this conference last year, I realized this. you know how when we are in this room, we have like the silverback sitting in front. If we have a question period, they will lift their hands, they will ask the questions. The students, the trainees, they will be sitting in the back. They will not be daring to ask a question. Many of them may not be able to afford to attend such a conference. Now with these online access, this actually is a huge opportunity. I'm not arguing against meeting in person. We need this. We all love it. And it's absolutely necessary. But having this opportunity to attend virtually, that's a huge game changer for training everywhere in the world. So there's lots of things that we can do. And this is what we're trying to do with our decade and with other programs, trying to break down those barriers and make things accessible.
Thank you.
Nino, what is your perspective to overcome these challenges?
Thank you. And at first, I would like to really reflect on what you said about the listening, the patients. I think this is extremely important. And I want to highlight what the WHO is doing in terms of the building the capacity of the member states, the countries, the policymakers actually to use the behavioral and the cultural insights to understand the barriers and the drivers of the cancer control across the continuum of care. This is critically important so that we understand why the HPV vaccination uptake is low or why the screening uptake is low. So understanding individual aspects of the behavior and the cultural aspects to lead the policy development in the right direction. And a good thing that we are seeing more and more ministries of health and the National Public Health Institute interested to develop the structure within their institutions on behavioral insights. So that's really good news. I would like to mention here the WHO European Program of Work, which was adopted by all the 50 member states, and it is built on the premises that we can tackle the health challenges only together through the collaboration and through the partnerships. So we launched last year the Pan-European Cancer Movement, United Action Against Cancer. That is a platform to strengthen the partnership and collaboration between the different agencies that are dealing with or working in the cancer control, with the civil society organizations and the youth as well. And just in a week, on 25th and 26th of October in Albania, in Tirana, there will be Youth for Health Forum, which brings the youth from across the WHO European region to discuss and engage them in the health aspects that matter to them, including on cancer, and agree on the way forward, how we can engage them in all the aspects that also related, in all health aspects also related to the cancer. I think these types of the collaboration and the broad forums are very important for us to really make the difference. The second point which I want to make also is we need much bolder actions from the national and the local governments, and collaborations for the multi-sectoral actions. I mentioned the obesity, right? No single intervention can halt the rise of obesity not only in the European region, but globally. And none of the European member states, on the path to achieve the targets, halting the rise of obesity by 2025. So we need fiscal interventions, fiscal policies to increase the taxes on the sugar-sweetened beverages, restricting the marketing of unhealthy food to the children. We need much bolder actions and measures and the regulations to tackle the tobacco control. So if we look at what the tobacco industry is doing in terms of the changing the narrative, promoting their heated tobacco products as a harm reduction strategy, and we know that tobacco is responsible for 29% of the lung cancer, and the best bet for us to prevent the lung cancer is actually to tackle the tobacco control. So we really need to have the bold actions, bold policy actions, bold regulations, and the control measures on the tobacco control. The third point that I want to make is importance of building the networks among the research institutions, professional societies, and the healthcare entities, which is a really powerful way to tackle the inequalities that we are facing in the region in terms of the cancer care. And my final point is about the funding and the resources for the non-communicable diseases, including the cancer. For the last years in the European region, the countries are providing the funding to tackle the NCDs at regional and global level. And this has been really key to establish the minimum critical capacity in the countries to be able to take forward all the action plans, all the national strategies, and political awareness to change. But the NCDs, the non-communicable diseases, including the cancer, remains most largely underfunded public health issue in the world. So we really need to tackle this aspect if we really need to want to make a change. Thank you.
Thank you very much. Dr. Ohnesorge, what do you think about what is the major barrier you would like to overcome with health technologies, artificial intelligence, emerging new technologies to get treatment closer to the patients, but not only in Europe, not only in Germany, but worldwide? What's your vision?
So it's probably not the one barrier to identify, but if kind of like to build it a little bit. Speed is super important because the right starting points are made. I mean, to now see the European Beat Cancer Plan, it is very concrete. We have seen in prevention the success of screening of skin cancer, of breast cancer, of other types. Now, lung cancer and prostate cancer are the next in line. Evidence is there, tools are there, technology is there. It just has to happen. Yes. It will, because it requires, just as in breast cancer, advanced imaging and in vitro test tools. It will require investment in the healthcare systems. It will require at the same time to compensate the additional workload that will be on the healthcare systems, digital tools that assist medical professionals in dealing with that workload. And in this, it is strongly encouraged that we really look holistically at partnerships of the academia, of the private sector, in really being enabled to develop data-driven, AI-based technology that helps, while the demand is increasing, to help also medical professionals to cope with it. And concurrently, the knowledge we will generate along those ways, hopefully in only a very few years, concurrently make it accessible to the low and income countries. Because as Veronica has said, the digital world we have experienced in COVID has no frontiers. You can concurrently make knowledge available to other countries in a digital way, be it in tumor boards, be it in technology tools, AI-based readings, and so forth. So I think that partnership engagement of public sector, private sector, and academia, and building that trust, I think, is key. And I would like to raise one example, actually a German-based initiative, also led, amongst others, by the Charité, the Vision Zero. It's a Vision Zero, started as, can we eliminate cancer altogether? That might be a bit for next generation to solve, but can we avoid cancer deaths? And while the first glance you believe, whoa, that's pretty bullish statement, it is not out of the world. If you find cancer early, if you prevent it, you find it early enough to cure it, and if you find it at least early enough to treat it as a chronic disease so that people don't have to die of cancer, this is not unrealistic to achieve in a few decades. And this is what requires collaboration across all areas.
Thank you.
Eiko, we also did a study about COVID-19 and woman cancer, and I think I was really shocked that every second woman had much more fear against COVID-19 than of progression of cancer. So communication is everything. This, I think, is your code.
Yes, that's right. I just want to reflect on Veronica's thoughts that small things matter. In these days, the gynecological department of the National Institute of Oncology in Hungary, the department was renewed, and they had asked us patients about the colors of the wall or handles or pictures, everything. And they implemented everything. And patients are satisfied and they feel themselves absolutely different in the hospital than before. And with the communication, I really want to reflect on some words that if we talk about knowledge, we have to talk about understanding. And if we talk about access, we have to talk about offer. And going back to the understanding, just imagine that most of the women don't understand, for example, the difference between a cytology and the HPV test. Oh my God, and digitalization is here. So we have to give understandings as well, not just the knowledge. Or patients have to understand what is happening with them because of their life, because of their healing, because of the treatment fidelity, or the response of the side effects or data. It's really crucial. People have to understand what is prevention, why is it a value in their life, right? So what is crucial that doctors are the trusted sources for patients. Accessibility alone is not enough. We have to be offered. If the doctor doesn't know about the available treatments or prevention tools in the country, then he or she won't offer it. The other point is the roles of the patient advocacy groups are really important. But from their side, they really need to learn. They really have to be updated. They really have to build partnerships, relationships, and also translate. We know that our work is translating the professional language to lay language. Why? To understand it. So we have to put the patient in the center. And also, we are managing the whole patient pathway. So therefore, we need the knowledge as well. And we touched this point with the culture, but I think the generation, the differences among generations is really on the table. It wasn't so powerful before, but now we have to focus on the different generations, different channels, and the different languages. For example, in Engage, we have a teens program, and we have it in the Mallow Flower Foundation as well. And with the teens, 10 to 18 years old, young, we are creating comics about HPV prevention. And we share these comics on Instagram, on TikTok, because these are their channels. So I think we shouldn't forget that the knowledge, it's not itself a professional knowledge, because the knowledge is the professional knowledge, the patient experience, the patient information together. And we have to work with the knowledge the way it is. Thank you.
Thank you very much. I think we had a fantastic contribution of all these distinguished speakers. Thank you very much. Complementarity is key with the governmental, intergovernmental, civil society, private sector, and political leaders have to come together to tackle cancer in its totality. We have a window of opportunity, Nino told that there is political awareness, at least, to do something on cancer, but we need to invest much more because it's a huge problem. And I would like now to open the floor for we have only a couple of minutes, 15 minutes. Questions from the audience, and we have questions also from the internet. I would like to, first was, the lady, and then please.
Thank you very much. I'm Elizabeth McIntyre. I'm here as a representative of the Université de Paris-Cité in France, but also as European, but also as European Hematology Association president, and especially today as future president of the Biomedical Alliance in Europe. And I'm very delighted to see our gynecological colleagues here present. But I think academia is singularly lacking on the podium. I know you're here for gynecological oncology, but my question is to Dr. Onesor. We know that diagnostics is going to cost more. Current European regulations on diagnostic safety is going to make diagnostics much more expensive. We hope for good reasons, but for reasons we don't have time to go into. The manufacturing sector has done very efficient advocacy for making sure almost all diagnostics comes through the industrial sector. And I am, as head of in vitro diagnostics, I'm very conscious of the risk for innovative diagnostics being squeezed out of the current European legislation. And I spend a lot of time talking about that. And I love the comments about the need for communication, because we really need to make sure that the academic community is also sitting on the table with respect to innovative diagnostics. Thank you.
So maybe just to tackle from two angles. First, I fully agree with you. I mean, the close partnership with academia is super essential, both from the side to the policy, also for the private sector. I mean, there's no result of developing a technology that can be used by physicians as a product without having it tested exhaustively in academia and then also in the more general care. Absolutely. And that is going to be key to success moving forward. At the same time, yes, I think this was the other part of your question, the complementarity of more high-tech type of tests, imaging, with probably easier to apply in vitro tests is going to be key to look at that complementarity, so that at the end, the best package or the best combination or the best test at the right point in time is being used, so that it's not always only the most expensive one up front. But this is where academia has to guide us the way of looking at companion diagnosis, how at what point, what test result is best to have for the right decision of the next step on the path. Yes, and the partnership of academia with private sector of building those technologies is going to be key.
Only to give one comment, because that's what we do. So even the doctors, and I'm also a researcher, we have even to blame ourselves. It's not something very bad, but global health is something new in our societies. So we started a few years ago, and even in ESGO, a special task force, because this was really ignored for our research and even our clinical community. And I think this is the reason I love it, that you are really open for this, because there's not many of them. They have not seen the opportunities and even the task, because if we focus on global health, even our regional challenges will become better, even in Germany. So I like to learn from this. But this even our responsibility to be active, what we did in ESGO and even the other societies.
Thank you very much. I think just a comment from my side also, technology is contextual, and we are generally thinking about an invention works everywhere. And I think we have to create also a triangle, the societies, the inventors, and the countries, and to bring them together. And we are trying this. And I would like now to give the floor to my friend from WHO, who will make an announcement? Because we have talked a lot about prevention and tobacco, and you are doing something.
Okay,
Please.
thanks, Andreas. And I'm Vinayak Prasad. I head the tobacco control program in WHO in Geneva. And I heard Nino and others speak very well on tobacco control. My submission is as follows. In the last 10 years, if you look at the trend of tobacco use, 60 countries are now on track, 25 in Africa, His Excellency, 25 in Africa. Africa has done so well, but Europe has not. All the regions in the world trending down amongst women, except Europe. Amongst men, all regions trending down, but the slowest trend in Europe. Now, if you look at the difficult decisions made by European countries, tax, you've done extremely well. Plain packaging, warning labels, extremely well. But what you have not done are small, simple things. 100% smoke-free environment, hardly 12 countries. Direct bans and advertisements, indirect bans and advertisements where the tobacco industry is just pushing their products, less than 12 countries. We really need to move on those directions because these are softer issues. It's a political choices which you can make because the harder ones you've already made and you can start trending down. And so I want to just reflect this and see how that can go because these are simple measures. While I still get it that the comprehensive thing needs to move, how can you get these things moving faster? Because Europe is now lagging behind the rest of the world when it comes to tobacco use. Thank you.
But I also would like to mention that you are launching a global consortium on smoking cessation tomorrow. It's an historical act. And could you explain? Yeah. Okay. Somebody who would like to reflect on the tobacco problem in Europe, for example, Nino. Yeah.
No, absolutely. We need to do more, much more in Europe to tackle tobacco issue and the issue of the smoke-free environment and the tobacco taxation. So these are the areas that still need a lot of push. And of course, what is critically important, that's why, I mentioned the bold regulations and the bold actions, from the national governments are critically important. And the civil society role, the civil society movements. I come from Georgia, where the tobacco was everywhere, and it was very hard to introduce. We had the legislation, but the enforcement of the legislation was extremely hard to implement. And I was at that time in the Ministry of Health and leading the multi-sectoral committee for the tobacco control. And unless there is a very high level political commitment from the Prime Minister level, from the first person in the country, from the presidential level, Prime Minister level. So it was very difficult to push forward the tobacco legislation enforcement. And the second point, what made the difference in Georgia's case of tobacco control and the currently Georgia's tobacco control legislation and enforcement is considered as one of the strongest in the European region. That was the civil society. The civil society movement and the bottom-up approach, top-down, bottom-up approach. So that was sort of the unique combination of the measures that made a really difference in my own country. So, and there are, of course, a lot of lessons, I'm sure, from other countries in the European region that, could drive the tobacco control policies in the countries.
Thank you very much. I have one question from the virtual platform. Lisa Henning, Heidelberg Institute of Global Health, is asking the panelists, how can we incentivize policymakers to allocate more funding for NCDs? How incentivize? Would you like to come in?
Yeah, so I'm happy to comment because in a global health funding context, I think this is indeed true. This might be historically related because infectious diseases are very visible and they require an immediate response, whereas NCDs often are more insidious. And so you don't notice that nothing is happening. When I think about our funding, I have to say NCDs are the bulk of our long-term funding. Like DKFZ is one of the very well-funded, long-term funded research institutes. We have a strong program on dementia. We have a strong program on diabetes, on environmental diseases. So the question, I think, in this context is, how come that on a national perspective, we see NCDs, we call this Volkskrankheiten, so diseases of the people. That's the big ships of disease burden that we face. And how can we bring that recognition into a global health context? And I think funding is one aspect. I think one argument that might make this attractive is that if we look at our healthcare system and how this is actually funded, then it is the NCDs that make the world go round in healthcare. This is where the health insurance is what we pay our membership or our fees for. This is what the doctors get paid for. It's not the infectious diseases. It is the NCDs, the prevention programs, and the large population diseases that make the healthcare system that form the foundation of healthcare funding. And this may be something that we have to much more keep in mind if we support other countries to build up a healthcare system, that it is the NCDs that will essentially then carry healthcare in that country and bring it forward. But I mean, it is expensive. And the question is, how can we raise the funds necessary?
Yeah, please. Mm-hmm.
So public health is fundamentally political. So my answer will be political. In order to incentivize policymakers to take more funding to the healthcare system is really the bottom-up approach. It must be a political issue. Policymakers listen to the voters. They care about staying in office. And if it's very clear that the lack of funding to healthcare is going to impact you at the polls when they're free and fair, I think you'll get a little bit more attention there. The second thing is public health conferences generally is the choir singing to itself. You'll find our health ministers and officials from our health ministries, but our fundamental gatekeeper of how healthcare funding is distributed is the Minister of Finance. So we must have our ministers of finance at meetings like this one. The third is that, again, when it comes to budget allocations, that also is entirely political. So your first gatekeeper, being your Minister of Finance, needs to be on board with what you want to do. You spoke about the importance of your head of state also tapping into what needs to do. So you must look at public health as a political issue, as much as you look at it from a healthcare perspective.
Thank you very much. Now, there are a couple of questions in the audience, and we have to stop the dialogue in the public, but I encourage you to take your questions and to talk and to interact with our speakers, because we would like now to have our final round with Jalit.
Yes, dear panelists, it's amazing work and discussion. And we promising that we, Andreas and me, and all the teams at World Health Summit like to catch you and to distillate you. So, Professor Veronika von Messling, so if you have one wish until next year, so we will have a recall. I promise to you, we have a recall. So what you like to see within the next year until the next wonderful panel?
Maybe on a more abstract point of view, ask more, why not, and less why. And on a specific point of view, I think we hope that with our decade against cancer, we've really advanced some of the goals that we've set out, like founding these national cancer centers and getting them off the road. I mean, we haven't spoken about this because it's a national thing, but the things that will be developed there, they will not be limited to Germany or to the center, but the aspiration is that they will contribute to better cancer care everywhere. So I'm hoping we have that off the ground. Thank you.
Bernd, that's your turn.
Good that I could think for a couple of seconds. I have one, but two flavors that are connected. First, I'd love to see the European Beat Cancer Plan really getting deployed in the countries. That in the EU is not a given, but that has to be. And in order to enable that, to enable also legislation of academia and private sector to partner, to develop data-driven tools to cope with these additional demand on healthcare systems.
Your Excellency.
So I'd like to just repeat something Elizabeth had said, is that when we have conferences like this, the first question we ask ourselves, who is not here? Whose voice are we not listening to? And between now and next year, what I'd like to see more of is the kind of collaboration we saw at African Union level, where our political leadership really made a great example of what collaboration and cooperation between African countries look like. I'd like to see more of that. And quickly to end, I'd like to end with Dr. John Kesogang's plagiarized 5 public Ps, pathogens, populations, policy. Political leadership, partnerships. I think those 5 things are key. If we can get those 5 things right that Ambassador Kingosang was talking about last night, understanding pathogens better, understanding our populations better, good policy, good political leadership, better, sincere partnerships. I think by next year, this time, we'll be in a better place.
Thank you. Nino.
Yeah, so the country is a focus, and next year I really would like to see the more countries that are on the path towards the elimination of the cervical cancer, and the roadmap that the all 53 member states, signed off and adopted this year. They really start, putting this in the practical terms, so that if I look back 20 years ago when I was a young physician, and I always remember this 10-year-old girl, who was standing in front of the operating theater when I was operating her mother for the cervical cancer. And she asked me about, my mother will be alive, will she be fine? Unfortunately, I could not save her. We could not save her. But I'm sure that, with the cervical cancer elimination, we can make this really legacy not only in the European region, but globally. So this is my commitment, and this is our commitment. So we have to really do whatever it takes to save the lives, those that we can.
Thank you.
Aiko.
I really want to see more collaborations among the European and non-European patient advocacy groups. That would be really nice to share ideas, share best practices, and work together. And also, I would like to see more understandings, but I don't know how we can measure it. I hope we have 1 year so we can figure out how to show you next year this understanding level. Thank you.
Thank you very much.
And Andreas, your wish, and I want to tell you, we know we have tomorrow, for the very first time at the World Health Summit, to invite all the societies to discuss how to collaborate regarding elimination of cervical cancer. Thank you personally for your engagement. What is your wish for next year?
Well, my wish first is that we establish our Center for Clinical Global Women Health. We are not only organizing panels, but we are working within a clinical context in global. And this is, we can announce, it is now there. Yes. A foundation, public-private partnership, and I'm really proud that this Charité is hosting this new center. What we want is to anchor global health, clinical health into an academic context. So I would like to thank you very much. Think about Berlin also not only as a venue for World Health Summit, but also there's many things around to discover. And I hope see you again at the latest next year, the World Health Summit. Thank you very much for your fantastic contribution. I think we gave a very broad view about what is cancer, what are the needs, and why we are a global community. And we have to work together. Thank you very much for coming from so far from Namibia. Thank you.